is Good Day Street Talk.
Joining me now for more is Dr. Gabe Wilson, who is Associate Medical Director at St. Luke's Roosevelt Hospital's Emergency Department, and Dr. Monica Halem, who is a dermatologist from Columbia Doctors East Side. Hello to you both.
Hi.
Let's start with the general effects of the cold weather. Is it true that being out in the cold weather can make you sick? Is that a myth or a fact?
Well, being in the cold can reduce one's resistance, but the greater factor is that people tend to be indoors more during the winter. So they're more exposed to each other, so viruses propagate. They spread much more easily than during the summer when people are outside more spread out. And in addition, because of the low humidity, viruses actually can live longer on surfaces.
Okay, what if a person doesn't feel the cold? I mean, I know people who go out in just, a puffy vest and that's it in the coldest of days. Do they have to bundle up even if they don't feel cold?
Everyone generates heat at a different rate, especially depending on your exertion. I think you have to use some common sense. If you're, running really fast, you're going to dress in fewer layers than someone who's not really exerting themselves much. But it's different for everyone.
All right, and one of the biggest things we worry about or think about in the winter is skin. The skin gets so dry. Dr. Wilson mentioned that lower humidity. What is it about the winter that just is terrible for our skin?
So your skin, actually, it's disastrous in the winter. So the skin is one of the largest organs in the body, and it's very susceptible to the climate change and the environment. We see anything from dry, rough skin to chapped skin to increases in rashes and eczema and a lot of itchy skin from the winter. You have decreased humidity in the winter, and then chilling winds like we have today, and then you're going to go inside and have the change in the indoor heating, and all that can wreak havoc on your skin.
So do you have to go out? I mean, everyone thinks when you have dry skin, you think you've got the worst dry skin on the planet. Do you have to go and maybe get a prescription from your doctor, or is what you find, in the drugstore aisle, would that do?
So usually what you find in the drugstore aisle is perfectly fine, and what you want to use is something that's more of a cream based instead of a lotion based. So that has more oil or more petrolatum in it, which will actually seal in the moisture of the skin. In addition, you want to make sure that you have sunscreen. People often forget in the wintertime not to use sunscreen, but the sun is just as strong as it is in the summertime. Okay,
and of course, that's a nuisance for people, but there are some much more serious health risks. We talked about shoveling snow, because we've had so much, and for people who may have heart problems. What is your advice for people shoveling?
Well, I never want to discourage anyone from exercising, but shoveling snow is an intense burst of exertion. Light shoveling is pretty similar to what you'd jogging about 5 miles an hour, and heavy shoveling is about jogging about 10 miles an hour. So if you can't sprint a quarter mile in 90 seconds, you probably shouldn't be doing heavy shoveling.
Really?
Yeah. Okay.
And in terms of, the ice has been another very hazardous situation. Have you seen a lot more people coming in with, slips and falls? And I don't know if there's anything you can really do to prevent it other than not go outside. What can you do?
There are actually some things you can do at a different time of year than the winter. So the people most at risk of falling are those with slower reflexes and less muscle mass, which tend to be the older population. And once they fall, because of brittle bones, they're more likely to fracture. And a hip fracture can be debilitating or actually deadly for an older person. So keeping oneself in shape away from the winter, increasing muscle mass by weight workouts, cardiovascular and stretching can really impact the health of older patients.
How has the season been with the flu? It's not been a news story, but have you seen a lot of people come in with the flu this year?
Several weeks ago, I think we hit our peak. There were definitely people coming in with the flu, but it's not any different than any other regular season.
Do you find that the cold weather reminded people to get their flu shot? I mean, people just seem to think the cold and getting a cold go hand in hand.
I think more and more people are getting flu shots, and that's great because it's helping us see fewer cases.
Any other winter problems in terms of the skin that you would want to talk to people about? You mentioned people with pre-existing conditions like eczema, it can get worse.
Right, it does tend to flare in the wintertime, but you also want to, prevent that from happening. So you really want to be consistent with how you moisturize your skin. And I like to tell my patients, when you get out of the shower, you want to pat yourself dry so you're still a little bit moist, and that's when you apply your moisturizer. So you want to seal in the moisture as opposed to just putting it on dry skin. Other tips could be make sure you drink a lot of water. The skin gets hydrated both from the inside as well as from the outside. And don't forget to protect your lips. We often forget that our lips are very susceptible to chapping and dryness, and you really want to make sure you're consistent. Carry it around with you in your purse, in your coat, and apply it pretty frequently.
Do dry lips have a cumulative effect? If you let them get dry and chapped, will they sort of be worse over time, or is that something that will repair itself once the warmer
The skin
weather?
actually repairs itself every 14 days. So, you know, in the warmer weather, it will get better because there's more moisture in the environment, but it doesn't necessarily keep progressing. You'll just have dry lips the whole winter.
Now, you have a really good tip for dry feet. A lot of people get those, you know, harsh heels in the wintertime. What's the best way to deal with
So
that?
the best thing to do is to use either a petrolatum product, a Vaseline, or something called salicylic acid or lactic acid, all of which are over the counter, and apply that at night and either use socks or white cotton gloves and sleep in that, and your hands and feet will be perfect.
All right, may not be sexy or pretty, but it does the trick.
Good advice.
And thank you for the good advice for, you know, our very critical health issues that we may face in this very cold weather. So once again, my guests were Gabe Wilson of St. Luke's Roosevelt Hospital and Dr. Monica Halem of Columbia Doctors East Side.